Hi, future RTs. Today, let's spend a little bit of time talking about coughing. So coughing is part of airway clearance therapy. In and of itself, we have to cough to clear secretions. Our patients have to cough to clear their secretions. But coughing is also used in conjunction with other airway clearance therapy, whether it be Medaneb, acapella, PEP, any of those type of airway clearance devices are always going to be followed by a coughing maneuver. And there are actually two types of coughs that we can coach our patients with. Let's talk about a huff cough first, okay? A huff cough is also called the forced expiratory technique. So you may see it referred to on the exams like that, a huff cough, the forced expiratory technique, or FET. And so this question is saying a huff cough should be recommended for a patient with which of the following? And of these, huff coughing is very beneficial for people that have emphysema. Okay, and here is why. An emphysematic, this is the terminal bronchial, that leads to the alveoli, okay? And a person with emphysema, their main anatomical alteration is distal airway and alveolar weakening. So what we're saying right here is the airway that leads down into that alveoli, and the alveoli itself have lost elastic fibers. So it's super easy for air to get into them, which is why an emphysematic has so much air trapping. But when a person that has distal airway and alveolar weakening, when they go to cough, that cough is a positive pressure. They're going to bear down against a closed glottis. And when that happens, these little terminal bronchioles will collapse with that positive pressure, trapping all that gas in the alveoli. Okay? Now, when they take a deep breath again, that airway will open, but during the cough maneuver, because the distal airways and alveoli are weak, they will collapse, leading to more air trapping. So with those patients, we want to do a huff cough or a forced expiratory technique. So the way you coach this is you have your patient set up, you have them take just a little bit deeper breath than normal, not a huge breath, a little bit deeper than normal, and you have them stage that cough 2 or 3 times with an open glottis. So this is what it sounds like. That will prevent that compression from happening and those terminal bronchioles from collapsing. Okay, so COPD, emphysema especially, the forced expiratory technique is a wonderful cough technique to teach. All right, second cough is what we're teaching all the time, is a directed cough, telling our patients take a good deep breath, bear down against a closed glottis, and cough really hard. All right, and sometimes, especially if somebody is post-op, whether they have thoracic surgery, upper abdominal surgery, lower abdominal surgery, maybe they have cracked ribs, they've been in some kind of accident that there's a lot of bruising, that directed cough hurts. So what can we do to minimize that pain during a directed cough? All right, so B, bending at the waist, C, elevating feet. I just made that up, okay? So neither one of those are going to be viable options. Now, some people have talked about pain medication, and it would be nice if we were able to give pain medicine every time we had the patient cough, but it's not realistic. You can't take Tylenol every hour, so you cannot take morphine that often either, okay? So pain medicine is not going to be a realistic way to minimize pain during directed coughing, but splinting is. So splinting is taking a pillow and putting it over a surgical incision or over the chest if a person has cracked ribs, and kind of squeezing against that site with the pillow. So a person will be able to generate a more successful compression and expulsion if you do that, because it just stabilizes that incision and it makes them feel a little bit more protected, and it allows them to bear down a little harder. So splinting, if you're not coaching that with people with surgeries, thoracic and chest surgeries, and abdominal surgeries, go ahead and work on splinting with them. That'll help them greatly. All right. See you soon.